All right, it's 1 o'clock, so I think it's just about time to get started. Welcome everybody to the Michigan Works Association 2021 Annual Conference. My name is Tom Audio, and I am the training specialist at Upper Peninsula Michigan Works. On behalf of the staff at the association and our sponsors, we would like to thank you for being a part of the conference, as well as this session titled Childcare, Reopening Doors and Reopening the Future. Before we get started, I just have a few housekeeping items to touch on. If you're not speaking, please make sure that your audio is muted to eliminate any potential background noise. Q&A will be reserved for the end of the session, so if you have any questions throughout, feel free to post those in the Q&A portion of the chat, and we'll get to those at the end. We're eager for your feedback on the conference and the session, so there will be a link to a survey posted in the chat. So if you could, please take a moment to respond to that. And presentations will be available post-conference on the Michigan Works Association website for you to view later. Without any further ado, I will hand things over to our presenters to get things started.
Good afternoon, everyone. I'm Tamara Gaines, Talent Development Liaison from the Michigan Department of Labor and Economic Opportunity, Industry Engagement Division, joined by Cheryl Bergman, CEO of the Michigan Women's Commission, Brent Jones, Vice President, Shiawassee Economic Development Partnership, and Jamie Gaskin, CEO, United Way of Genesee and Shiawassee County, presenting on Childcare, Reopening Doors and Reopening the Future. Once again, the chat will be monitored for questions throughout the presentation, and we will respond to the questions from the chat during the Q&A session at the end. So to get started, I would like to give just a little bit of background information on the state's state employer-focused program, which is the Business Resource Network, also known as the BRN. BRNs use a demand-driven sector strategy framework of multiple employers within an industry or geographic area, building partnerships that bring together education, workforce, and community organizations to identify and collaboratively meet their workforce needs. And some of those services include, but are not limited to, rent, utility expenses, auto-related expenses, public transportation assistance, child care assistance, financial literacy training, and budget development assistance. In addition, success coaches assigned by the local Michigan Works agency are utilized to assist employees with defined barriers and serve as a resource at the employer's location for employee accessibility. The primary benefit for an employer in joining a BRN is the ability to provide sustainable employment to residents with employment barriers from within the employer's community, resource to employees to allow them to work toward becoming financially independent, therefore increasing their ability to be productive, attentive, and present at work. Participating in BRN member employers can expect to experience return on investment in the form of lower turnover rate, lower subsequent hiring costs, reduced costs associated with tardiness and absenteeism, increased staff morale, improved productivity, cost savings related to common training, and worker skill building. Eligible employees will be employed by a member company of the BRN and have one or more of the following demonstrated documented barriers to employment: returning citizens, homelessness, mental or physical disability, substance abuse, living at or below the federally established poverty limits, lacking a high school diploma or high school equivalency, long-term unemployment, receiving or have received state or federal public assistance within the last 12 months, and of course the ALICE population. The development of the BRN through June 30th of 2021 includes 22 active BRNs across the state, representing 15 of the 16 Michigan Works agencies, with active BRNs of 38 of the 83 counties, which are highlighted in blue on the map. The BRN will sunset September 30th of 2021 and will continue in some regions through the Michigan Works agencies in partnership with employers and community partners as self-sustaining programs. The Department of Labor and Economic Opportunity collaborated with the Michigan Works Agency, BRN managers and coordinators, and established monthly meetings to identify some similar and different barriers employees are facing. So these are just some of the successes that we've seen during the collaboration. One of the priority barriers identified with the bi-monthly BRN meetings was childcare. The Department of Labor and Economic Opportunity and the 16 Michigan Works, which all 16 we did begin with, developed a subgroup to address childcare. The group meets monthly and created an employer and employee survey to disseminate regionally to gain feedback on local childcare barriers. Results of that survey, or those surveys, I should say, are currently pending employer and employee completion. The Michigan Works agencies do plan to share the survey results from employers and employees collectively and have data to support future childcare initiatives. Monthly meetings of the collaborative effort include regional partners such as the Michigan Women's Commission, Economic Development, and United Way, which are some of today's presenters, taking what they have learned locally and sharing to make an impact statewide. I'm sorry. Next, we will hear from Cheryl Bergman of the My Trishare Childcare Initiative. Cheryl is the CEO of the Michigan Women's Commission. Prior to the commission, Cheryl worked to elect well-qualified progressive women, local and statewide. Welcome, Cheryl.
Thanks, Tamara. Good afternoon, everyone. Like Tamara said, I am Cheryl Bergman. I'm the CEO of the Michigan Women's Commission. And in late 2019 and early 2020, the Women's Commission, along with Governor Whitmer, held conversations with women around our state to identify their priorities. And wherever we went, from Grand Rapids to Flint, Detroit to Traverse City, we found that economic security issues were top of mind for the women of our state. Especially, and always at the top of the list, is affordable, accessible child care. And that was before the pandemic hit and shut us down. You can go ahead and move ahead, Tamara. Or do I have the ability to move my slide? Oh, there we go. You can keep going. One more. Thank you. If you want to back up one. So what we can tell from data in the United States, in the whole country, that more women, and you can see by this slide, more women are leaving the workforce due to childcare related challenges than men. And if you want to skip to the next slide, the Department of Technology Management and Budget in the state released a report, a Michigan Women in the Michigan Workforce Report this March, at the end of this March. As of March, when they released the report, when approximately 136,000 women had left the workforce in Michigan entirely. As of July, that number has increased to approximately 203,000 women who've left the workforce entirely since February 2020. And the unemployment for Michigan is 4 times higher than the pre-pandemic rate. So, and they will continue to update this number. So this, obviously, the pandemic, childcare has been an issue for a while for women in the workforce and families, period. Affordable, accessible childcare. The pandemic has really shone a light on how much it affects the women in our workforce in Michigan. You can go to the next slide. And this is a slide. We don't have any specific data in Michigan to say that these 203,000 women left the workforce due to childcare. We can anecdotally say that. And as you can tell by this slide, the return to work is heavily influenced by parental status and gender. So women with younger children are much less, in Michigan, have not returned to the workforce. Okay, go to the next slide. So, there is no economic growth without women, and women cannot return to the workforce without childcare. Go on to the next slide. And as I described, before the pandemic, childcare affordability and accessibility was an issue, and it continues to be so, and now even more so. You can go on to the next slide. There are access to care remains a challenge today. Some work sites are closed due to the pandemic. Childcare providers have reduced their hours or the number of children that they accept. And there are people are facing childcare deserts without a lot of options to meet the demand for childcare. And care is still not affordable for many families. And Trishare, and some parents are obviously still concerned about safety. Governor Whitmer recently announced her proposal to invest $1.4 billion federal dollars from the ARP to expand childcare with the following focus areas: to help stabilize childcare businesses, to expand access to care, to help eliminate deserts, to make childcare more affordable to our families by expanding eligibility for the childcare subsidy in Michigan, and supporting our early educators by giving them a living wage. We can move on to the next slide. So, back one. Thank you. So Trishare is one innovative public-private partnership to address affordability and accessibility. This idea of Trishare was born in the west side of the state with Representative Van Workum and the Grand Rapids Chamber and a coalition of community partners and businesses over there and this was pre-pandemic. They've been talking about this for a couple of years before the pandemic really shone a light on the need for affordable, accessible childcare and a program like Trishare. And the Women's Commission just implemented. And the idea of Trishare is that the employers pay a third of the childcare, employees pay a third of the childcare, and the state of Michigan pays a third of the childcare. Move on. We have currently 3 Facilitator Hubs. 3 regions of the state are piloting this program. United Way of Northwest Michigan is serving a 5-county rural area region in Northwest Lower Michigan. Goodwill Industries of West Michigan is the Facilitator Hub serving Muskegon County. And Saginaw Intermediate School District is serving the Great Lakes Bay region. We also have the potential very soon to expand the pilot with private foundation funds in West Michigan and Southeast Michigan, including Detroit. Move ahead. Thank you. So we implemented the program. We kicked it off. We selected the hubs in the middle of March of this year and kicked off the pilot in the middle of April. And it really took us between April and mid-June to work out all the kinks, figure out eligibility, et cetera, for employees, marketing materials for employers, employees, et cetera. And we ran into a few issues. If you want to move ahead one slide. Well, I'll talk about this first. So the guiding priorities for Trishare are that families have a choice in the childcare as long as it's licensed childcare. That is a requirement to participate in Trishare. It has to be a licensed childcare facility. To help childcare providers secure some slots and help them stabilize their business. To make sure that the facilitator hubs are handling all of the administrative work, so it takes that burden off the providers and the employers. And we are targeting the ALICE population. So the employees that are eligible for Trishare are those employees who are currently between 150% of the poverty level and 250% of the poverty level. So they don't qualify for the Michigan child care subsidy, but they still struggle to afford childcare. Okay, now you can move ahead again. So currently we've actually just added a couple of employers. So we're at 10 employers who have officially signed on across all of the 3 hubs. And the employers are representing a number of industries and size of business, from manufacturing to healthcare and civil and social organizations. And we have had some delay in signing up employers. It's taken a little more time. So one thing that we have done is expanded the timeline of the pilot from March of next year to the end of July of next year. And you can move on to the next slide. And I can let you know a little bit from the employer's perspective. They had summertime with the rollout of the Trishare program. They had already had their budgets in place for the fiscal year. So figuring out how to budget for this additional childcare cost was something that slowed them down signing up. We found that some were having trouble identifying childcare slots for their employees. So the deserts were an issue. And so we just had a little bit of a delay, or it took a little while for employers to figure out how to make this work internally for themselves. But it's really starting to roll now. Like I said, 10 have signed up. From July to August, we added, I think, 7 employers. Move on. So we distribute monthly, and these are on the Michigan Women's Commission's website as well, which is michigan.gov/MWC. But we distribute monthly reports, status reports. Like I said, those are all on our website right now. We plan to, in the next several weeks, probably 4 to 6 weeks, expand the pilot to Southeast Michigan and West Michigan with private funding. We will have an external evaluation of the pilot to hopefully, explore, is this program sustainable statewide? And currently, the legislature is looking at the recommendation to expand this pilot into FY 2022 with $2.2 million, the governor's recommendation to expand the pilot to a couple more regions in the state in FY 2022. And we're cautiously optimistic that that funding will go through. Again, I said that we extended the pilot year from March 15 to end March 15, 2022 to the end of July 2022. And we continue to meet with the hubs monthly to talk about, to exchange ideas and to collaborate and to problem solve. Next slide. And I think that is really about it. What we are hopeful, I know that there are Business Resource Network folks on today, and if you know of any employers who might be interested to learn more, please connect them with me, and I'd be happy to talk with them. Thank you.
Excuse me. So while it may not show up that way on your screen, I am Brent Jones, Vice President of the Shiawassee Economic Development Partnership. And we were able to facilitate some partnerships between businesses and childcare providers in Shiawassee County to try to start addressing the shortfall that we were seeing across our community. If we could go to the next slide, please. So as an economic development group, we really pride ourselves on offering customized solutions to the employers that we work with. And going as far back as even 2018 and 2019, well before the pandemic hit, we were hearing from a lot of our employers that childcare was becoming an ongoing issue from their staffing perspective. Either folks leaving employment because they did not have reliable childcare, or simply couldn't take a position due to childcare issues, to your day-to-day absenteeism if a babysitter was sick, things like that. So we started to reach out to our childcare providers in the area to see if there was some sort of gap that could be filled and help to try to sort of alleviate some of these issues. And while they were very receptive, it became clear that they had sort of their own issues to deal with. Workforce availability on the childcare side was an immense challenge for them. Facility space limited the number of childcare slots that were available, and to add additional square footage or facility amenities to what they had already was a challenge from a capital perspective and generating enough cash flow to cover it. So we can go to the next slide, please. So what we started to try to do is just make connections where possible, with the hope that we could find something, a partnership where an employer could start perhaps subsidizing childcare for employees, and maybe that could generate some of the cash flow necessary. We held a community forum for our employers as well as our childcare providers in Shiawassee County. And we had a great turnout, a lot of discussion, a lot of energy. Folks were really excited about the possibility of working together to address these needs. But the takeaway, as we really came away with it, was that we needed a data-driven solution. We had plenty of anecdotal evidence, but we needed to dig a little bit deeper and come away with something more actionable for our partners to work from. So from there, we were able to engage. Sorry, my slides are coming a little bit behind on me. I think we can move ahead another slide here. So we were able to engage a national child care provider called Childcare, who's really going to help us with a market study. And through that process, we really tried to engage our community across all sectors. So we had direct interviews with some of our largest employers to see what needs they were aware of for their staff, and where they could possibly be a willing partner in any projects moving forward. We had direct interviews with our childcare providers to learn more about their challenges and what their needs were to get things moving forward. And I'm still seeing a slide behind. Sorry if this is coming off as a little bit confusing for everyone. And then beyond the one-on-one interviews with our providers and our business community, we also did full surveys across the community as well, just to find out what our average childcare users needed. So this was a really in-depth process that we were able to undergo because of a partnership with the Genesee Shiawassee United Way, our local Cook Family Foundation, and the Shiawassee Community Foundation, who put forward some of the funds to actually put this study together. And the report that was generated out of this really gave us a good picture of what we were dealing with. It was clear that we needed more just childcare slots. Our providers were mostly full. There was a mismatch between the hours of operation of the providers and the business community. So what that means is we had an employer who, for example, started their first shift at 7 a.m., but if all the local childcare providers don't open until 7:30, that's no longer a viable option for the workers there. So that was another issue that we're trying to address in working with the providers. And we can move ahead to the next slide there. And that's when we were able to engage with actually another partnership to bring more resources available. That was the Small Business Development Center and a group they're working with on called First Children's Finance. So the SBDC is able to work with our childcare providers who are interested in expanding to look at things like business planning needs, preparing financial plans for possible investment, and then through First Children's Finance, actually having access to some of those funds. So right now, we were able to put several of our providers in touch with that partnership. And moving forward, we're actually starting to see some good results. If we could go to the next slide. The outcomes of what we've seen from this are that We had one childcare provider in our community who's moved to a substantially larger facility and is now operating at a larger capacity. So clearly that's not a cure for what our needs are as a community, but it's an important step in the right direction. We've also got 3 other local providers exploring expansion opportunities through SBDC and our Economic Development Office as well. From our perspective, we're still working to attract larger scale childcare providers, as we really feel that's necessary to make an impactful change in what we're seeing in the marketplace. Beyond that, we've also, as a community, applied for grant funding through the Childcare Innovation Fund to try to help our local providers address some of the financial shortfalls that are still holding back some of their expansion projects. And I know we've got Jamie Gaskin, the CEO of United Way of Genesee County, who serves Genesee and Shiawassee, who's a partner with us throughout this entire process. And at this point, I'll throw it to Jamie if you have any further comment you'd like to add.
Yeah, I'll just be brief before Tamara helps us go through all your questions. We're, as a United Way, we're a major investor in the coaching of the BRN and the barrier removal process. So we've been investing money in those programs. We've also, as was mentioned, we also invested in helping put the study together to try and understand the data in Shiawassee County. You've also heard Alice referenced a number of times. The United Ways together across Michigan pay for that Alice work to be done. And in all this, we obviously see that childcare is a huge, expensive problem, probably along with the big 3, right? The transportation is always an issue, housing is always an issue, and childcare is always an issue. And childcare really seems to be, most of the time, probably the most expensive issue. And the biggest barrier to a lot of folks getting back into the workforce and being successful. So we have a deeply vested interest in this work. We know we cannot pay for it as philanthropy. There's just not enough money. If we take all the foundations and donors in that area combined, we can't pool that money to pay for all this childcare. It really has to be a partnership between the employers, between the families themselves investing, and between government. So we try to spend a lot of time lifting the data and trying to understand it, and then really encouraging and motivating all those partners to work together. And that's really all I want to share. And I'm going to hand it over to Tamara so we can handle your questions. We're super excited about sharing this. We feel really good about all the work that's being done and are just really proud of everybody doing this together.
Thank you, Jamie. So to close out our presentation today, we do have some calls to action, and it's really just about working together. The Business Resource Network, the Michigan Women's Commission, again, Shiawassee Economic Development Partnership, and the United Way of Genesee and Shiawassee County have all had success with collaborating with community partners. We encourage developing strong connections with your local Michigan Works, as they can be an advocate to engage with employers, especially through the BRN. It's also encouraged for the 2022 My Trishare Childcare Initiative that the Michigan Works work with, with active BRNs, service hubs, potentially, once the RFP is released. So again, we just want to thank everyone today for joining us, and of course, the presenters on our panel today. This concludes our presentations, and we will open up our line for discussion. And I know that there were some questions put in the
yes,
chat
I've been keeping
here.
track of the questions, so I can start on those. These relate to the Trishare program. Have you seen BRNs partner with hubs in your 3 areas? BRN companies seem like the perfect target audience for Michigan Trishare.
Not that I'm specifically aware of that they are BRN partners, but they might be. I haven't looked into that. So I don't know specifically if any are partnered already with the hubs, but yeah, I agree that they are perfect employers to be partnering with on this project.
And I can jump in on that too. Our area did not get one of the pilot grants, but that was a part of our local plan. The employers in the BRN were core potential partners for it. So we think that's a good match as the program expands.
Absolutely.
All right. These next few questions also pertain to the Trishare program. What size employers participated in your pilot?
So far, they've been from large to small. So we've had like Cherry Republic, for example, which has retail stores throughout that Northwest Michigan, Lower Peninsula area, to Munson Healthcare, which is a large employer. So it's been, for the 10 employers right now, it's been, runs the gambit from small to really quite large.
All right. And can you talk about the pre-existing employer relationship / partnership before you collaborated on this initiative?
Sure. So in the RFP process, the potential facilitator hubs needed to have, I think it was at least 3 letters of intent from employers in their regions to participate in the pilot program. So some of the applicants came with many more than 3 letters of intent. So they did their homework a little bit and their legwork a little bit before they even applied for the Trishare grant. And then, like I mentioned, this whole idea started with the Grand Rapids Chamber of Commerce and the business community over there in Grand Rapids in the west side, and Representative Van Workum, who represents the Muskegon area. So they had some collaboration from businesses over on that side of the state talking about Trishare and how to make it work.
All right. And one last question for Trishare. Can you describe what the funds pay for? What about the low wage problem of childcare workers and getting qualified help?
Yeah, I mean, that's one of the huge issues. And in fact, one of the employers who is participating in Trishare is an actual childcare provider. So they are using this as an incentive to attract workers, childcare providers, so workers in their childcare facility. So, and the low wage for childcare workers, Trishare doesn't specifically address that, but the governor's recommendations for the $1.4 billion in federal dollars to the state strictly for childcare does address the need for higher wages for our childcare providers. And I forgot the first part of the question. Oh, how are the funds, what do the funds specifically pay for? The funds pay for, the grant funds go directly to the hubs to pay the childcare provider. So the hubs are responsible for collecting the childcare payments from the employer, the employee, and the state of Michigan each month and pay the provider. So the funds from the grant go for childcare costs, and there's an 8% administrative cost to each hub for this grant. So really it's all, except for 8%, it is all administrative costs. The rest of the grant is all childcare, goes to the childcare providers to cover the cost for the families.
All right, so that does it for questions that we have in the chat up to this point. If anyone else has any questions, feel free to post them in the chat, or else you can feel free to share your audio and video if you want to hop on stage and sort of have a discussion with us. I'll post the link to the survey in the chat right now. So if everyone could just take a moment to respond to that, that would be greatly appreciated. So that pretty much concludes the presentation for today. I would like to thank all of our presenters. Thank you so much. We appreciate everybody's time. I hope you've had some great takeaways and will continue to enjoy the rest of the conference. Thank you so much for attending, and we look forward to seeing you again tomorrow.